So good evening, everyone. Today we have gathered here to hear a wonderful webinar from Dr. Sudeep. To give you an idea about a short intro about Dr. Sudeep graduated from JSS Medical College, University of Mysore, and trained in endocrinology in Newcastle upon Tyne, UK. And also, he's a consultant endocrinologist at Apollo Hospitals and St. Philomena's Hospital, Bangalore. And he has keen interest in teaching and currently program champion for internal medicine at Texila American University as well. He has been a trainer for MRCP and PACS basis exams as well. So, welcome, Dr. Sudeep, and you can start now.
Thank you very much. Good evening, everyone. I thank Texila American University for inviting me to give this talk on did you know that you could become a Royal College certified health professional? I myself am a Royal College certified professional. I trained in endocrinology in the UK. So following my graduation, I did go to UK, trained in the NHS. I have done my general medicine training with an MRCP UK degree and did my endocrinology training with MRCP in endocrinology, and also completed the certification for specialist training in the UK, with which you could become a consultant in the UK. Following my training, I've come back to India. But whilst I was in the UK, I had a keen interest on MRCP training, had been involved regularly in training sessions for colleagues and trainees who work with me. And I'm glad that I'm still continue this training with the Royal College certification. So when I was preparing for this talk, I got to know quite a few things. One was that there are 23 Royal Colleges in the UK. So each specialty has a Royal College. Most of us would have heard about the physician, surgeon, gynecology, but there seems to be a Royal College for veterinary medicine, dental sciences. Quite interested to know that all these Royal Colleges have a tradition. They have been there for centuries, and have been to the Royal College of Edinburgh, where during my graduation ceremony, and a couple of more times after that for conferences. And you can see the photographs of me with the then president of the Royal College of Physicians at Edinburgh, Professor Neil, uh, during my MRCP graduation thing. And the building is still about 5 centuries old, 3 or 4 centuries old, and they still maintain the same architecture, same interiors. And when you go to the college, you'll be given a free tour of how the college is history as well. So there's something about the Royal College certification, its standards, its tradition, um, and its pride to have a Royal College certification. And the thing is, you don't have to be in the UK. You don't have to have all the training in the UK to become a Royal College certified professional. You can do that as long as you've gained the skills anywhere in the world. So let me talk you through how you could become one. So the agenda of the talk today would be a bit about healthcare and medical training, postgraduate training in India. Then what is Royal College certification? Then its benefits and how do we get one? And I'll go through at least in detail, at least in some of the popular specialties. And certainly would be able to answer any of your questions at the end of this talk. So let me start with healthcare and training in India. So India has a huge 1.2 billion population. So healthcare in any country is challenging, even in India, with its urban and rural, predominantly rural setup challenge. Healthcare provision is a challenge. Along with that, the current WHO recommendations are there should be one doctor for every 1,000 patients or every 1,000 population. And the current ratio in India is not all that good. And it's largely skewed with most of the doctors being in the urban areas. And it's not only that, there's a huge deficit in specialists as well. When I say specialist, it could be a physician, a general surgeon, obviously, specialists such as endocrinologist or neurologist. And further, healthcare is provided mainly in private health setups, though the training opportunities is predominantly in government-run or private-run medical colleges where only a few of us continue to work in. So we are not necessarily trained in hospitals which we are going to, or the kind of healthcare setups which we will continue to work in. Though we train in medical colleges where the kind of patients you see may be completely different to ones where you're working in a corporate hospital. Your choice of treatments may be different. You may have access to different sort of investigations which you may be lacking when you were trained in medical colleges, which I suppose, you learn and train on the job. Um, so there are some limitations as well to the training and healthcare setups being in India. Previously, once you graduated, had your MBBS degree, uh, most people would be happy. I think at least 2 or 3 decades ago, you would be quite happy. You would have set up a hospital, you would have gained your experience, and set up your own clinic or continue work in hospital and gaining a special interest. But over the years, at least in the last few years, specialization uh, is almost become necessity, um, or you need to have a degree more than MBBS to one. You need adequate knowledge to treat your patients, and also with the current healthcare setups, the more qualified you are, the better your job prospects are. And so once you finish your MBBS, people always look for clinical and get into the clinical field, paramedical field, non-clinical fields such as healthcare, administration, or you may plan to go travel abroad. So most graduates want to continue being the doctor with a healing hand, the remaining clinical specialties, and all of us know to get into a postgraduate medical degree, you need to prepare for and appear in the NEET exam. And once you clear the NEET exam, you're eligible to apply for a postgraduate medical seat in India. And the choice of your specialty all depends upon your ranking. So it's certainly a very competitive exam. And you will always not get the choice of training you had wished for. So you may want to become a surgeon, and your ranking may not get you a seat for a surgery. And there are many who compromise on their career choice, which they may not be happy for the rest of their lives. Though there's a lot of guidance available about how to prepare for the NEET, there are so many coaching centers, and you'll have your friends and seniors who may advise on how to prepare for the exam. But once even, well, say, one I told you that postgraduate uh, examination is quite competitive. Currently, there are about 30,000 postgraduate uh, seats in MD and MS in India, and about 150,000 graduates appear every year. So it's about 1:5 uh, ratio, even when you write the exam. But to get into a clinical field or the specialty of your choice, and also the college of your choice and place near home, you may have to have a better ranking, and it becomes almost challenging. Further, you might get a medical seat, an MD medicine seat, or MD radiology seat in after qualifying from the NEET exam, but you may have to travel several thousands of kilometers and be away from home during this period of time. And uh, this is the age where most doctors get married, and if your wife is also a doctor, your wife might be staying away, training in a different medical college again, several uh, kilometers away, so that the work-life balance is severely hampered. Further, it's very expensive in private medical college. This is example. So if you go for a private medical college, deemed to be college university in Karnataka, you may have to shell out about 30 lakhs per year for MD medicine, which is about 1 crore after your 3 years training. Not only this, if you were to get in government medical colleges, you may have to serve a bond to work in rural areas. So many of us want to work in it and help the nation, but some of us not want to be at home or work in the hospital which you already own. Um, and so that becomes a challenge in the career. So what is this Royal College certification? So Royal College certification is UK's postgraduate medical qualification, which is equivalent to the MPMS in India. So MRCP, which stands for Member of Royal College of Physicians, is equal to an MD medicine in India. MRCS would be equivalent to MS surgery in India. MRCOG is equal to MD or MS gynecology in India, and so on. The Royal College certification, as I earlier said, there are 23 different Royal Colleges. So you have certification available in most core clinical specialties. And people always have that, you always have to be in the UK, train in the UK to get a Royal College certification. That's not entirely true. You could get a Royal College certification having trained outside UK. What are the benefits of getting a Royal College certification? So number one, with Royal College certification exams being quite standard, structured, and recognized worldwide, the Medical Council of India and most of the state and almost all state medical councils now recognize Royal College certification as a postgraduate medical degree. So you can be able to practice legally practice as a specialist in India. Not only this, so you once you achieve uh, Royal College certification, you may wish to consider career move abroad. You could work, pursue working and training further in the UK and NHS. And I'll briefly talk to you about the medical training initiative in the UK in the next few slides to come. And so you have such benefits. And you can obtain these certifications while training in India. So you can get your Royal College certification while you're already in your MDMS training program, or you could. So, there are many doctors, have colleagues uh, working, junior colleagues working with me as duty doctors. They gain a lot of skills. We share knowledge with them. They see patients regularly. Uh, they know how to uh, manage uh, patients, but they don't gain a qualification or they don't gain a degree. They have that knowledge. And um, such doctors, you've already worked in hospitals for 5 years, you already have clinical skills knowledge. Uh, why not get this Royal College certification using your clinical skills and knowledge? Get your Royal College certification and then practice as a specialist. Certainly, that's something all young doctors can consider, especially if you failed to get a postgraduate medical seat in the specialty of your choice. So how do we get certified? How do we get certified as Royal College? Uh, is one, you can go to the UK. So UK is the England, Wales, Scotland, Ireland, Northern Ireland, or being in India, you could train in India too. So I'll talk to you about both of these. So if you were to go to the UK to train in UK to get your Royal College certifications, again, benefits are Royal College qualifications recognized worldwide. The training, I can vouch for being trained there myself. It's quality controlled, standard training. Any hospital, any university you're working, you are assured to gain the same skills, uh, and they are certainly world class and top class. You have access to research in the UK. You have good standards of pay, an excellent work-life balance. You would work 9 to 5 even whilst training, and which is not seen anywhere in the world. And also, you would get an opportunity to experience living in the UK. And if you want more information on working in the UK, you can visit this website called nhsemployers.org, a guide to work in NHS, which gives very good information. If anyone wants to get in touch with me, I'll be able to share these links. But to work in the UK, you should have a registration like Medical Council of India. The UK has General Medical Council. You have to get yourself registered. So there is provisional, full registration, or specialist registration. Uh, these are the different kinds of registrations available with GMC. So once you have graduated, you get your full registration, and once you have finished your specialization, you get full specialist registration. Apart from registration, you also need something called as license to practice. To get a license to practice, uh, you should. There are certain criteria which most of us would be able to. So to work in the UK, you need to be registered with GMC and also have a license to practice. So to get a GMC registration, you should have a primary medical qualification, which is MBBS degree, which is acceptable. So your medical training should be recognized by GMC. And if you visit the GMC website, it will tell you all the medical colleges from India where uh, you have recognized qualifications. Apart from this, you will also have, it says you should have requisite knowledge and skills for registration. That is, you would have to do the PLAB examination, which is Plans for People and Linguistic Assessment Board. And once you clear the PLAB exams, that would mean that you have the requisite knowledge and skills. Then you have to pass the IELTS ELTS examination, which is the English exams, show that you have the necessary knowledge of English, and you should have a certification from your local medical council saying that you are not impaired for practice. So you can. There are other ways to get your registration, but for most young doctors who just graduated, the be through the lab. So again, English language proficiency, you need the IELTS must score 7.5 or more, or there is also the occupational English test where you should score grade B or more. So you have all this information on the web if you want to find out more. Getting a score of IELTS score of 7.5 and above, it should not be a problem. And so say you have done all your registrations, and then if you want to go to the UK, then there is the thing about immigration visa. There are different kinds of visa, Tier 1, Tier 2, Tier 5. So Tier 1 visa is what you would need, and currently it's challenges to get a Tier 1 visa. So duration of training, so to get the general, the basic specialty training would be about 2 to 3 years. Gynecology might have to take 4 years, and specialist training would be another 3 to 5 years, depending upon which specialty you're at. So usually, if you want to get a Royal College certification from the UK, challenges are currently immigration issues. The other problem would be finding an adequate opportunity as well, especially in internal medicine training or the basic surgical training. There might not be vacancies easily available. Though there might be choices for specialist training vacancies available currently, because the number of graduates in the UK have quite a few numbers, but many of them opt to go into general practice and might not want to be in hospitals and become specialists. So specialist training may be easily available, but not with basic medical and surgical training. So immigration issues is a challenge, obtaining a training post challenge, and along with that, there are finances involved to travel and sustain yourself, at least for the few months after the UK, and cost of living in the UK is certainly. So why not try and get Royal College of Physicians certifications from India? So these are some of ones you may have heard of. If not, general medicine would get MRCP, surgery would be MRCS, pediatrics would be MRCPCH, MRCOG for gynecology, and there is also anesthesia, radiology would be FRCR or FRCA, and emergency medicine also. So I will go through some of these specialty trainings individually. So because I'm sure there's the audience today might have doctors with different aspirations, wanting to train in medical, surgical, pediatrics, or different specialties. So if you want to train to be a physician and have Royal College certification, there are 3 Royal Colleges in the UK, Royal College of Physicians in the UK, the London, Edinburgh, Glasgow, but they all work together, and it's an intercollegiate exam. There are 2 written exams and a practical exam called PACES. Um, and all the practical exams in the UK is more or less the OSCE station, which is objective, structured clinical examination. And one of the things you want to be informed is all the Royal College certificate examinations look at the UK curriculum, UK guidelines specifically. So if you are uh, wanting to get these Royal College certifications, you should be well aware of the curriculum and the UK guidelines specifically managing patients, which more or less are similar to the American, European, Indian healthcare things, but there are some specificities which you should be aware of when giving these exams. One of the important things I have to highlight here is the eligibility for this. So anyone with 12 months experience, postgraduate medicine experience, so you have finished your MBBS and worked a year in Department of Medicine, whatever specialty it is, whichever hospital it is, you would be eligible to take the MRCP Part 1 examination. So it's only 12 months of postgraduate experience. And it doesn't have to be in a training setup. So even to work in a hospital as a service provision setup, you would be still be eligible to take this exam. So partner exam is still, it's about basic and it's a clinical science exam. It's a written exam, test of 5 questions over 3 hours. Part 2 again is a written one, more emphasis on clinical understanding and clinical judgment. So most of the questions are clinical scenarios where uh, again in best of 5 format. And the PACES exam uh, is is a practical exam on OSCE stations. There are 5 stations. There are 7 clinical skills, which is usually about communication, diagnosis, history taking. All those are evaluated. It's a half-a-day exam, and the only criteria for that is you have to have had finished the Part 1 exam within the last 7 years. Part 2 is not essential. Uh, to get complete MRCP, you should pass all those written exams and this exam. So, if you have gained adequate medical knowledge working in hospitals in India, this is an exam which you can easily pass uh, with some hard work and preparation and understanding of how this exam runs. You'll be able to pass the Royal College exams and be Royal College certified. This is more the general medicine or the physician training part of it. And every specialty has a similar format. You should have had some basic experience in the specialty. To start with, when you write the written exams, and over the next few months, years, you would have gained more experience and you'll be able to finish all your written exams and sit for the practical exam. And over a 2 to 3 year period, you could be a Royal College certified professional. I'll go through the next few specialties. As well, surgical, it's very similar to the physicians, 3 Royal Colleges. Again, an intercollegiate exam. They have Part A and Part B. Part A is again a written exam, any medical qualification acceptable to the council of the colleges is eligible to take. There are 2 papers in this, a test of 5 basic science and also principles in surgery in general. And once you pass Part A and have uh, and continue to work in general surgery, you'll be eligible to take the Part uh, Part B. And again, this is an OSCE exam with 20 10-minute stations assessing applied knowledge and applied skills. The pediatric Royal College certifications has 2 qualifications. The MRCPCH is more the main qualification, though they also have a smaller DCH diploma in child health qualification. So for the MRCP, again, they have 3 different theory exams and 1 clinical exam. So all these, so the three theory exams can be taken in any order and completed. And once you've completed this, you do the clinical exam. But if you're doing the DCH, you don't have to do all the exams, but just do the foundational practice exam. So again, for pediatrics, the time of training. So you should have completed a period of training of lasting 2.5 years from graduation date. So you should have already have a 2.5 years of pediatric experience before you get the exam, and at least 12 months, or if not minimum of 6 months, should have been spent in unselected emergency admissions. So anyone who's working pediatrics should know this. Um, and also you should have worked as an in-house pediatrician. So anyone who is working in pediatrics, training in pediatrics, they should not be difficult at all. And once you've done your theory exams, you have your OSCE, again similar 10 stations, and you should have 2 years training in pediatrics. The theory exam part of it, 2.5 years post graduation can be in any specialty, but at least 12 months should have been in pediatrics. And for the clinical exams, you should have at least 2 years of training in pediatrics. The diploma exam is again it's usually for non-specialists such as people training to be family medicine doctors. So if you could always get this diploma in child health degree, and with an extra degree, and at the same time you are reading for the exams and gaining knowledge for certain. And with this degree, you could certainly practice as a pediatrician. Though if you're only if you have the full degree, you might have better opportunities working at a hospital as a pediatrician. So again, if you the next is the obstetrics and gynecology, so MRCOG, similar pattern again, part 1 written, part 2 written, and part 3 is the clinical examination. So similar again, like the other all other specialties, MRCPG would want you to have a medical degree which is recognized by them. And one of the things with the obstetric gynecologists is that you should apply to them first for eligibility. Once they review your degree certificate, then you'll be given a place in MRCOG1. And again, similar written part 1, 2 papers, MRCOG part 2, can only be taken after 4 years of training in obstetric and gynecology. Again, it's a written paper with SBA, which stands for single best answer, and EMQ, which is extended matching questions, which is more like match the following questions. So these are all written exams, and the MRCOG is again a clinic OSCE exam with 14 stations, which assesses patient safety, clinical applied knowledge, and communication. So one of the things you may have noticed in all the OSCE stations is me mentioning communication, patient safety, application of knowledge. So most of these Royal College certification exams have a lot of importance given to communication, patient safety, and other factors, which is, I suppose, very, very important these days in our current practice of modern medicine. So certainly having these skills will help us practice safe medicine and also have happy patients in your clinical practice. Like the pediatric, the gynecology services also has the RCOG, a diploma exam, again a single written exams for 3 hours. And the Royal Colleges of Obstetrics and Gynecology website says that this is again for general practitioners or non-gynecology doctors who want to have a degree in gynecology so that they could work to some extent in private women health clinics. So if you are a general practitioner and want to have some extra extra qualification. This is something you could consider. So apart from this, next is radiology. No, not only these, radiology is more a paraclinical science, so you'll have to be quite a bit of clinician as well there. Uh, so radiology, you get a fellowship of Royal College of Clinical Radiology. Then again, there are two parts in the first exam. This is about a bit of physics and anatomy, and the final FRCP has two parts. One is written, and the one is more practical, such as sessions. And for this, you should have at least 34 months of training in radiology. There's also emergency medicine, but when I was looking through the emergency medicine college examination requirements, it is more stringent, and there are some of the things like the quality improvement project that you may have to demonstrate. Uh, so critical appraisal, so which is short answer question paper. So there are a few other things here. So if someone's interested, I think the emergency medicine, FR's Royal College Emergency Medicine website has more information. So at least so far, I have talked to you about challenges of getting a postgraduate medical seat, and even if you've got one, the challenges of walls, finances, while staying in India. Also talked about how you could go to the UK and get Royal College certification and the challenges associated with it. And I also did mention that stay in India, train, and get the Royal College certification. And Texila American University is offering this for young doctors such as yourself who would want to get a postgraduate, recognized postgraduate degree whilst training in India. So you could visit their website, ucn.edu.org, College of Postgraduate Medicine, which gives all the details of how it is. Their program is, I would say, an exclusive, structured Royal College training program. And in this program, you would train at several premium training centers. I currently work at St. Philomena's Hospital, and St. Philomena's Hospital is Bangalore is certainly an excellent training center for DNB school. We have DNB medicine in medicine, surgery, gynecology, and it produces an excellent set of specialists. And you could be part of their training program and get Royal College certification. And uh, along with this, the Texila University has uh, incorporated several training programs which run very similar to how it is done in the UK. So your 3-year general medicine training program, you would have training for training and preparation for and coaching for during the part 1 exam, part 2 exam, regular OSCE sessions, internal exams, or as per OSCE PACES exams. I'm talking about general medicine being a physician, and it's the same with all other specialties. So certainly you could consider this as an excellent choice if you're struggling to get through the NEET exam, or you're not finding the specialty of your choice through the NEET program. Another thing I wanted to mention is about the medical training initiative. It's one of the great benefits if you have Royal College certification. So this is the medical college training initiative is from the Joint Academy of the Royal Colleges, which is the 23 colleges. It offers post to overseas trained doctors to further train and experience in the UK for up to 2 years. It's more a specialist training. So if you are in the Department of Medicine, you could train in pulmonology, endocrinology, geriatrics for a couple of years, and then you could be back in India to practice as a specialist because you would have gained significant skills and knowledge working in the UK. And this is the same in surgery, gynecology. So you could, by surgery, you could practice bariatric, upper GI surgery, colorectal surgery, hepatobiliary, or if you're in pediatrics, you could do pediatric endocrinology, cardiology, gastroenterology, and so on. Or you could just gain, say, in obstetric gynecology, you could just gain more experience and understand how the healthcare system elsewhere works and take in all the good points for your own practice. So the medical training initiative specialty offers include more or less all core specialties. So what are the criteria? The minimum criteria for a medical training to get into the medical training initiative is appropriate postgraduate qualification. So if you already have the MRCP qualification, that would be classed as an appropriate postgraduate qualification. Or it could just be you could have part 1 college exam or an equivalent. So if you've done your MRCS part 1, you could get into a surgical training course for about 2 years in the UK. And again, with already having your skills here, you could work in the UK, gain more skills, and also you would have the opportunity to finish your MRCS or the Royal College Certification exam of your choice there. For gynecology, generally need 3 years of postgraduate experience. Though if you have not finished, if you have finished your Royal College certification here, it's excellent because you would gain a specialist experience there. If you have not, you could, if you have the postgraduate experience, you could go there, finish your Royal College examinations while you're working there. So you should have finished your internship on 1 year of specialty at least. Then you should pass in the IELTS examination. So, and you should have reference from a supervising consultant or from fellows of the Royal Colleges. And in India, there are several doctors who are fellows of Royal Colleges. And you should have lived overseas at the time of application. You can't be in the UK and apply for this scheme. And you should be signed to say that you're going back to your home country for training in the UK, which most of us already won't do it. So, the most important thing of whichever career path you choose or whichever certification you choose is planning. And it's the same for the Royal College certification to try and make sure you gain adequate skills and knowledge, try and obtain the skills necessary, especially for the Royal Colleges, and planning essential and helpful. So to summarize, I would say postgraduate training is now considered an essential qualification in current and future times to come by. Postgraduate training in India is very competitive and has challenges with financial impacts. Royal College certification is a recognized qualification which can be obtained from India and has certain benefits which could offer. Most importantly, plan your career path, work hard, get your scores high, and uh, you could get a training post or work in a get a qualification in the specialty of your choice. With that, I finish my talk. I wish you guys all the best and thank you for your patient listening.
Thank you, Doctor. That was a wonderful session. So, as I told you before, we will be telecasting this in all our YouTube channels as well as of the
Mhm,
Facebook medium.
mhm.
So, when we come across any other questions, we will share that with you and we will be in touch with you.
Great. Okay, thank you.
Thank you so much for your time, Doctor.
You're welcome. Thank you.
Yeah.